All right, let's dive in. Today, we're going to tackle a pretty hefty topic, the latest global guidelines for anemia and chronic kidney disease. But don't worry, we're not going to just read a medical document. We're going to break it down and turn it into a simple, clear roadmap that actually makes sense. So let's start with a number that really makes you pause. Over half, think about that, more than half of all people with advanced chronic kidney disease, or CKD, also have anemia. And this isn't just some number on a chart. It's a condition that really gets in the way of everyday life, your energy, and your overall health. And that really begs the question, right? We think of kidneys as our body's filter system. So what on earth do they have to do with our blood? Well, it turns out the connection is absolutely vital. So first up, let's explore that very connection. We're going to get into what anemia actually is and why it's such a big deal for anyone managing chronic kidney disease.
Okay, so what is anemia? The simplest way to think about it is a shortage of red blood cells. These are the little delivery trucks that carry oxygen to every single part of your body. The official definition, the one doctors use, is when your hemoglobin, that's the protein doing the carrying, drops below 13 for men and 12 for women.
So here's how the kidneys fit in. Your healthy kidneys are like a command center. They produce this really important hormone called EPO. Now, EPO's job is to send a message to your bone marrow, which is basically the body's blood factory, and tell it, hey, time to make more red blood cells. But when the kidneys are damaged, that signal gets weaker and weaker, and the factory just slows down production. And that's exactly why this is so much more than just a lab result. The real-life impact is huge. We're talking about a kind of fatigue that's bone deep, that frustrating brain fog where you just can't think clearly, and a much bigger strain on your heart. Is directly tied to a lower quality of life and, unfortunately, a lot more time spent in the hospital. So, when anemia is suspected, what happens next? Well, doctors don't just guess. They follow a very clear and logical roadmap. It's like a step-by-step investigation to figure out exactly what's going on. The investigation always starts with a few key blood tests. We've got the CBC, which is a general overview of your blood. And then they look at two iron markers. Ferritin, which is like checking how much iron you have in the warehouse, and TSAT, which tells them how much of that iron is actually on the delivery trucks ready to be used. From there, it's a simple process. First, confirm the anemia. Second, investigate the iron situation. And, if things are still murky, they'll do a deeper dive to look for other causes. All right, so that brings us to the first line of defense, fixing the iron problem. Because iron is one of the essential building blocks for red blood cells, making sure you have enough is the absolute foundation of any treatment plan. But here's where iron deficiency gets a little tricky in chronic kidney disease. It's not always about the warehouse being empty. Sometimes your body has plenty of iron, but it's all locked away, trapped. There's this gatekeeper hormone called hepcidin that basically holds the iron hostage, so your bone marrow can't get to it. The iron is there, but it's not usable. So to get more iron into the system, doctors really have two main tools. First, you've got oral iron, pills. They're convenient, they're inexpensive, and they're a great starting point. But they can sometimes cause stomach upset, and they don't always get absorbed well. The other option is IV iron, which goes straight into your bloodstream, bypassing any issues in the gut. It's a faster, more direct route. The best choice is always a personal one, a conversation you have with your doctor. Okay, so you've addressed the iron. It's the foundation. But what happens if your iron levels are looking good and your red blood cell count is still stubbornly low? What's the next play? Well, this is where we move into the next level of treatment, advanced therapies. These are the powerful tools that can directly tell the body's factory to ramp up production of this critical red blood cells. And there are two main types of these medications. You've got ESAs, which stands for erythropoiesis-stimulating agents, and a newer class called HIF-PHIs. Now remember that EPO hormone we talked about, the signal from the kidneys? Well, these drugs essentially mimic or amplify that exact signal, telling the bone marrow loud and clear, okay, time to get to work. Now this is super important, and it might seem a little counterintuitive. With these treatments, the goal is not to push your hemoglobin all the way back up to normal. Instead, the guidelines recommend keeping it below 11.5. And why is that? Well, a lot of research has shown that pushing it too high can actually create other health risks. So the real goal here is finding a safe, effective balance, not just chasing a number. And that whole idea of finding a balance brings us to what is, without a doubt, the most important part of this entire discussion, the shared treatment decision. Because when it comes to starting these more advanced therapies, you are in the driver's seat. Seriously, your voice is the most important one in the room. This is a conversation. It's about talking about your symptoms, what your goals are for your quality of life. It's about weighing the potential good against the potential risks and really thinking about what you're comfortable with. At the end of the day, your values and your preferences are what guide the entire decision.
So, what about blood transfusions? Where do they fit in? The best way to think of them is as a safety net. They're used when anemia gets really severe and you need to correct it fast. But they aren't a routine, long-term fix because they have their own set of potential issues, especially if a kidney transplant might be in your future.
You know, there's a quote right in the introduction to these guidelines that just perfectly captures why this all matters so much. It says that anemia is a common and serious complication affecting patient outcomes and quality of life worldwide. This isn't some minor side effect. It is a central part of managing CKD and helping millions of people live better lives. And so all of this really leaves us with one final, big question to think about for yourself or maybe for someone you care about. What does truly patient-centered care actually look like for you? That's the conversation. That's what this is all about. Thanks so much for joining me.